Dentistry has changed over the years. Today, patients can get more than just a great-looking smile. Dr. Sean Keller, along with the team at Smiles by Design, focus on offering personalized, total health care combined with an artistic touch to enhance their patients' natural smile, resolve problems caused by TMJ, or help them look younger with facelift dentures.
TMJ stands for temporal mandibular joint, and that's your jaw joint where your jawbone attaches to your skull. And so TMJ actually, the disorder means the disorder of the joint. And so if your teeth don't fit together properly, that can push the jaw into a bad position, and that can cause migraines, jaw pain, popping and clicking when you open. It can cause neck pain. We call it the great imposter because it disguises itself as so many other disorders. People go to a lot of different doctors before they finally figure out that it's TMJ the whole time. We do a very thorough exam. So we take models of the teeth, we take x-rays. We have a 3D scanner that allows us to look at the neck and the head in all dimensions, and we can actually look at it from any angle. And if we see changes in the bones from that, it gives us a good idea of how it's going. The next thing we do is we use the neuromuscular technology from Myotronics, and we can read how your muscles work as the jaw opens and closes. We can even use computerized mandibular scanning, so we can move the jaw on the computer screen. So as people move their jaw, I can look at it on the screen and trace how it's moving, and we're looking at the muscle activity as that happens. And if we see aberrations in the muscles, then we know if things aren't fitting properly. After we decide that we think there's a good chance that TMJ is going on, we take impressions of the teeth, and at that appointment when we're trying to figure out is there a relaxed position for the jaw, we'll copy that and we'll send models to the laboratory. And then a couple weeks later we get back what we call the orthotic. And that's just a simple appliance that you snap onto your lower teeth, and it makes tiny but precise changes to the top of the teeth, just in acrylic, so it's completely reversible. You'll wear that for a period of time to see if the symptoms start to go away. Most people, the day that we put it in, it causes some relaxation, and people feel maybe 50% better. Migraines can go away. Headaches that were a 10 on the pain scale might go down to about a 5. If popping and clicking sometimes goes away right then, because now the jaw's not being pushed off its joint anymore.
Now, let's learn about facelift dentures and how they can help restore a youthful smile.
There's a huge population of people out there. 22% of people over 65 have had all their teeth out, and they're in dentures. Once you have your teeth out, you start to lose bone every year. And so you get this sunken in look with this chin up like this, and it gives kind of that witch look where the nose and the chin stick out but the teeth are back. And it's a very aged look, so people look maybe 10 to 15 years older than they really are. With the facelift denture technique, we can add that height back that they lost, and we can set the teeth where they used to be and make people look, instead of 10 to 15 years older than they are, they can look 10 to 15 years younger than they are.
Smiles by Design, where artistry meets superior technology to create exceptional smiles, because your smile is more than just a beautiful smile.